Dr. Tom Nabors is the Chief Dental Officer for OralDNA Labs Incorporated. He is co-speaking with a physician and a nurse by the name of Bradley Bale and Amy Doneen on November 2nd in Las Vegas. The title of the seminar that they are presenting is Vascular Inflammation, the Oral Systemic Connection. Dr. Nabors, thank you for your time today. Can you tell us a little bit about what prompted the development of this course?
Sure. Well, thank you, Mr. Hartley, for the opportunity to speak with you and to your audience as well. For those of us in the dental community, particularly dentists, periodontists, and dental hygienists, we have been aware of the oral systemic connection now for almost 2 decades. And there are 2 areas that we are trying to weave into our practices. One is the verbal exchange with our patients about the potential risk of chronic infections, and in particular the risk that chronic periodontal disease may have on our individual patients. And as that relates to the science, we are very well advanced today in understanding that chronic periodontitis is in fact an independent risk marker for cardiovascular diseases, including heart attack, stroke, and peripheral artery diseases. Even hypertension is associated with some forms of periodontal disease. On the other side of this educational model, and I make up 1/3 of this educational model, and that is the oral health side, in particular periodontal disease, are Dr. Bale and nurse practitioner Doneen. They have a unique experience both in the practice world and in the education world of actually preventing heart attacks and strokes. And their method, they call the Bale-Doneen method, is designed to do just that. If you are a patient of theirs, either one will educate you on all of the aspects of heart attack and stroke, and of which periodontal disease is one. But they will educate their patients on the factors that are associated in increasing risk for heart attack and strokes. And then they will also run appropriate tests that are designed to tell us as an individual patient whether we are in fact at risk, and if we are, what we can do to reduce that risk so that we don't have the event. And the event, of course, heart attack and stroke. So our effort with our course in November is to bring together 3 worlds. One, that is the physician world, the nurse practitioner world, and the dental world, so that we can discuss how we can all work together with this noble cause of actually preventing heart attacks and stroke.
And what do you feel like the dental professional will take away from the course when they go back home? What do you think they'll be able to do?
What the dental professional will take away would be, number one, is very accurate science. There has been a lot of confusion, and I would say even in particular when the American Heart Association article that came out in April of this year created even more confusion, even though the body of the article had excellent science that shows periodontal disease is independently associated with increasing risk. Unfortunately, they've had to go back and revise a lot of the statements that were made at the end of that, and in just this past month's Journal American Dental Association, there is revision statements about the positive relationships between chronic periodontitis and cardiovascular diseases. Therefore, the first thing the practitioner will get out of this course is accurate science. The second thing that they will get from this is how to use that. In other words, how do you look at a medical history to determine in your practice which patients may be at risk. And then the third thing is how to do an appropriate periodontal exam using not only traditional markers of disease, but also using salivary markers of disease that give a more robust picture of where individuals may be in their risk for number one, periodontal disease, and then number 2, for heart disease and stroke. So they will leave with accurate information. They will leave with actually a very, very important game plan as to how each practitioner can look at their patients somewhat differently. And, in other words, rather than just looking at an oral health picture, the clinicians will be able to help determine if or screen for patients that may be at risk for vascular diseases, vascular inflammation, which includes hypertension, heart attack, stroke, and peripheral artery diseases.
Well, and please correct me if I'm wrong here, but it seems like that this course is designed for dental professionals per se, but I noticed that a lot of the other courses on systemic connection that they present, I'm talking about Dr. Bale and Miss Doneen, are for all types of healthcare providers. Do these do you see a better connection occurring between in the healthcare community between the various types of providers? Do you see that as improving with this type
Absolutely.
of information?
Yeah, that's a really good question and a very good statement. And that is that there does have to be a collaborative effort so that those of us in the dental world can be educated about what the medical, or let's say the general medical world is viewing that presents risk. And then at the same time, we need to be educating the general medical world about what we are observing based on the literature. And the literature is going to be extremely important for us to educate each other. And what we are observing, and we've been doing this now for the past 2.5 years, is that when we bring all healthcare providers together, that we better understand what each of our roles are, and we also begin to communicate much better. In particular, when we are involved in the same community where we have, let's say, a physician or a nurse practitioner and a dentist or a hygienist or a periodontist, where we understand each other's role in this large picture. Certainly periodontal disease is only one of the risk factors that is associated with vascular inflammation. Another really good point here on this subject of bringing each other together is that certainly dentists and hygienists have begun to routinely take blood pressure. That's so important, and the reason it's so important is that even in a recent publication that was published as late as actually today, this morning, a revision of the PURE trial clearly showed around the world that approximately 40% of the world, or even in some cases much higher than that, have hypertension. And of course, hypertension is a very, very important risk factor that is associated with heart attack and stroke. But of this large population base that has hypertension, less than half of them know that they actually have hypertension. So the dental office, and that's one example how we can very easily determine by taking blood pressure whether our patients may be at risk for heart attack and stroke. And while we'll use that as a marker for risk, we'll also educate the group as to what other markers that you can use based on the medical history and based on your periodontal disease findings, the type of conversation that you would like to have with the patient and the type of conversation that you would like to have with your physician or the patient's physician, so that we can all then share a certain amount of responsibility in educating the patient as to which direction the patient can take to reduce the risk of them actually having heart attack and stroke.
Okay, well, those are good observations. I thank you for sharing them with us. The course is titled Vascular Inflammation, the Oral Systemic Connection. It's at the Renaissance Las Vegas Hotel on November 2nd. I will put up the website for the Bale Doneen method on the screen here. I guess that is the primary way for dental professionals to sign up for the course. They need to go through that website, is that correct?
That is correct, and it'll be very easy to find the date and the location. You can sign up on your computer.
Okay, well, thank you very much for your time.
Thank you, Mr. Hartley. Appreciate it very much. Bye-bye.